Hi everyone, this is Dr. Jenkins. Welcome to your first video. Yay! So the goal here is I really want to provide videos that help you focus on what's most important. And even though I've made these PowerPoints so you would be able to learn the material hopefully just by reading them, I think it's absolutely better when possible to hear someone go over it through video. So because of the technology, why not do it? So here we are with chapter 1, and this is our intro chapter. As you're going to see in the PowerPoints, I've really tried to let you know what's most important. So I've put it in red, I've underlined it, I put it in bold. So my goal is to really let you know what to focus on. There's so much information, it's impossible for us to learn it all. So I've tried to pick out the most important concepts that I'm asking you to know for our assignments, quizzes, and exams. All right. In this intro chapter, we're going to basically talk about definitions, terminology, and a couple of other things that really set the stage for this course in anatomy and physiology. Now, being that the course is called Anatomy and Physiology, I think it's pretty important that we define anatomy and physiology. How about that? So here we go. When we talk about the anatomy, we are talking about the structure in the body, the names of the bones, the parts of the cell, the regions of the kidney. These are all structure, and this tends to be very straightforward. Now, you can study the structure in different ways. You can do it as gross anatomy with your naked eye, what you can see. You can use a microscope. You don't need to know these. I've just listed them so you can see there's different ways. But really what's most important is the anatomy refers to the study of structure. On the other hand, physiology is the study of function, or you could say how the structures work together. So I encourage you to come up with terms or phrases that really help you understand in your own words. So for example, for anatomy, I tried to give you a key word, structure. Physiology, you could use a keyword of function, or maybe it makes more sense to say how the structures work together. So in the pictures I have on the right, an example would be of the anatomy, the bones themselves, the humerus, the radius, the ulna, versus the physiology, how those bones work together with the muscles to allow someone to swing a baseball bat. All right. That's just what I said, right? So again, I've made these slides so someone could review them on their own. So that's why you'll see a lot of repeats. I'm just trying to drill a point home. You can use different types of anatomy. I'm not going to ask you these. I think it's pretty self-explanatory. Physiology, which is how the structures work together, physiology tends to be a little bit more complex. You know, if you're a good memorizer, then you're going to like anatomy because you can just memorize the bones. You can memorize the parts of the kidney. The physiology tends to be less about memorization and just more about kind of telling a story. How does this work with that? How do we utilize pressure gradients or lever systems? So it's more complex, and a lot of times it's harder, but we need to talk about both. Okay, now this is not going to be a surprise to you. We're just giving a fancy term to it. There's this thing called the principle of complementarity. And all that means is the anatomy and the physiology are related. Again, use whatever phrases help you understand this the best. Anatomy and physiology are related, my friends. So things in our body are structured a certain way based on its function, right? The function of something is related to the structure. What a structure can do depends on its form. However you want to think about this might be your best way to think about it. The anatomy and physiology are related. They complement each other. Hence the term principle of complementarity. In the shoulder, you aren't going to have to know these examples, but I'm just giving you examples. In the shoulder, the ball of the humerus, the head, fits very loosely into the scapula. And the reason why there's kind of a loose structure is because we need a large range of motion for our shoulder to be able to function how we need it to. Other examples, think about the femur. That's your big thigh bone. Think about the structure of the femur. Well, it's big, it's thick, it's tall. Well, why is the femur so thick? Because it has to support the weight of your body. So the structure matches the function. We wouldn't want a thin old tiny bone in our thigh, because that would not be able to support the structure. All right, this is the example that I gave, both examples that I gave. So the structure and function are related. They complement each other. All right. In this course, we are going to be talking about each body system. And actually, I think this course is pretty cool. If you're going to be an EMT or paramedic, you should absolutely be interested in this, right? This is what you're going to be dealing with when you show up to a call. Something's wrong with someone's body. So you're going to have an understanding of how these body systems work. So these first couple chapters in the course were really just setting the foundation. For example, it's very helpful for us to break down the body. We can go from large to small, or we can work our way up from small to large. I prefer to start small and go large. If we consider the body, its smallest pieces are chemicals. So the smallest pieces are chemicals. And oftentimes, we're going to have to talk about these smallest pieces. We'll talk about potassium and sodium. We'll talk about calcium in the bones. These are important. Then, chemicals can work together to form cells. We have a whole chapter on chemistry. We have a whole chapter on cells because we need to introduce some important things. These cells are very important. A muscle cell is structured a certain way so it can contract. A nerve cell is structured a certain way so it can deliver nerve impulses. Then, when we have a grouping of cells of similar structure and function, the grouping of cells forms tissues. We have a whole chapter on that. We'll talk about the skin as a type of tissue, stratified squamous epithelium, and why it's structured a certain way. When we have similar tissues grouped together, they form an organ. Organs that work together form an organ system. And that's, in fact, what our body is, a collection of organ systems. This is really important, folks. Make sure you're able to give this list, either from small to large or large to small. This is how we're going to introduce this course. We have chapters on the chemistry, some chemistry review, on some cells, on some tissues, and then we'll get to all the organ systems. All right. Now, depending on how you count them, you could say there are either 10 or 11 body systems. We're going to cover all of them. What a great course, right? You're getting so much for your money. You really are, actually. You don't have to know these right now because we're going to talk about them in a specific chapter. But being being the intro chapter, I did list them for you because we are going to cover each of these body systems. We'll talk about the specific chemicals, the cells that make it important, and basically what its structure is and then how it works together. So you don't need to know these now. Okay. Look at that. Isn't it nice when we can just go through all the slides together? Now, this is obvious, I think, but it's really important, so we're going to point it out. These organ systems work together. You know that. Sometimes it's an obvious connection. The skeletal and muscular systems, well, they work together because the muscles have to attach to bones so that when a muscle contracts, it pulls on the bone and we have movement. Some are obvious. Another example of an obvious one would be the cardiovascular and respiratory systems. Well, of course, we utilize the respiratory system to bring in oxygen and get rid of carbon dioxide. And then we utilize the cardiovascular system to pump those gases around the body. Really important. Some are really simple. These are the examples that I gave, the skeletal and muscular system and the respiratory and cardiovascular system. You don't need to know these specific examples. Just know the principle that organ systems work together. Just giving you some examples. But then there's some other examples that may not be as obvious. I'm just going to give you an example. You don't need to know it. If I say to you, what do the respiratory and urinary systems have in common? How do these two systems work together? Well, you might say, oh, respiratory and urinary. Well, I don't know, the urinary filters the blood and then you pee out the waste. And the respiratory is all about exchange of gases. They seem to be different, when in fact they have a very important shared function. Both the respiratory and urinary system help us get rid of waste, right? We get rid of waste in the urinary system through urine. We get rid of waste in the respiratory system through exhaling carbon dioxide. And actually, those two systems can work together to regulate pH because their ability to get rid of these waste products is paramount, is needed in order for us to maintain blood pH. I mean, so cool, right? Yeah, I think so. All right. Another introductory piece here that we need to talk about. Every organism, no matter if it's a single cell bacteria or a human like you and me, every organism has to have certain characteristics. It has to be able to do certain things in order to live. You know some of these. Just be able to, let's say from a list, because your quizzes and exams are multiple choice, be able to identify these in a list. So for example, I could ask you, all of the following are characteristics of life except. So you know a lot of these. We have to be able to grow, not only grow as we get older and mature, but we also have to be able to grow. If we get a cut on our skin, we have to be able to regrow tissue. We have to be able to respond to stimuli, run away from pain. We have to be able to move, and it's not just walking, but it's movement of food through our GI tract, for example. We have to be able to maintain a boundary. Of course, we have our skin, keep good things in, bad things out. But also, we have a boundary over every organ. We have a protective covering. You think of the blood-brain barrier. We have a very specific, a very tough covering over our brain because it's such expensive and important real estate. We have to be able to digest food. We have to be able to metabolize it for energy. We have to be able to get rid of waste. We have to be able to reproduce, not just as a being, be able to reproduce and have offspring. We have to be able to reproduce cells. So I think a lot of these are pretty what you would expect. Let me see here because, let's see. Yes. There is another characteristic that we're going to talk about. I just don't have it on this list. How did I forget that? It just means I'm human, folks. Another characteristic of life is being able to maintain homeostasis, which we're going to talk about. I'll give you a little preview. We have to be able to maintain balance of all sorts of things in our body. We have to maintain a certain body temperature. We have to maintain a certain blood pH. We have to maintain a certain blood pressure. All these things are very important, and our body's ability to maintain those balances in spite of things changing all the time is very important. Okay. In addition to certain characteristics of the organism, we also need certain things to bring in to our body, to have in our body in order to survive. You know this. I mean, this is really common sense, folks. Be able to identify these from a list. We need food to fuel our cells. We need oxygen. All our chemical reactions rely on oxygen. We need water. Fluid medium participates in chemical reactions, helps to protect certain organs. We need heat. We need to have heat to keep us warm, to keep a good metabolic environment. We need pressure. We rely on pressure gradients for a lot. Oh my God, I can't wait to talk about this because we're going to get into it all. We need a pressure gradient to be able to deliver blood from the heart out to the body. When we break this down later in the semester, sometimes it's a really simple principle. And that's exactly how we move blood through the heart and through the body, is a pressure gradient, where it's higher pressure in one area, lower pressure in the other. And simply because fluid, just like air, moves from high to low pressure, then our blood can flow. Really cool. You know all of these things. I'm not going to ask you this, but these things absolutely relate to you. We talk about vitals. Assessing someone's blood pressure can tell us a lot about what's going on. If there's an abnormal temperature, that also gives us a lot of valuable information. You're checking respiratory rate. You might even check the blood oxygen saturation. So all these things are very important clues that you can use to assess a situation and then take the appropriate action. All right. This is really important, my friends. Homeostasis. This is one of those characteristics of life. Really important. Here is the textbook definition. Ooh. You can also put it in your own words. I think it can be as simple as the ability of the body to maintain balance. Ability of the body to maintain balance. Keyword there is balance. And we're talking about things inside of our body, such as core temperature, blood pressure, heart rate, blood pH, blood calcium levels, blood glucose, everything. Really, really important. And what I want to point out is, it's not always, or it's not only in the extreme. I mean, everyone can understand this when it's really hot or cold out. If it's really hot out, everyone understands that if it's too hot and our core temperature rises too much, there could be danger. So what does our body do to help maintain our normal core temperature? We sweat. We send fluid to the surface of our skin, which evaporates off of our skin and has a cooling effect. That's an easy example. But this process is happening other times too. Even as you sit there listening to me, whatever it is you're doing, hopefully you're awake. Even just sitting there, your body is constantly maintaining homeostasis. Maybe you haven't eaten for a while, so your body's got to work to maintain blood glucose. If you haven't eaten for a while, your blood glucose could drop, and it could drop to dangerous levels. Well, guess what? Your body senses that, and we're going to release glucagon, which is going to go to your liver, tell it to release glucose back into the blood, therefore bringing blood glucose back up to normal. So it's happening all the time, not only in the extreme, it's happening every minute of every day. And it's really important. Here are some other examples. If you don't already, as you can see it's in red, I would like you to know the normal range of blood pH. Blood pH. And this is a really good example because you know what? There are so many things that can change blood pH, yet our body can keep it within this narrow range really, really well. And that's a narrow range, right? And it doesn't take a change very far outside of that for our body to be in real trouble. So we're really good at it. If we're not able to maintain homeostasis, a lot of times it results in a disease process or a bad situation. If we have an imbalance of pH, you could become acidotic. If you can no longer maintain your core temperature where you need it to be, you could become hypo or hyperthermic. A disease process that's chronic would be like diabetes. Over time, if we're not able to maintain homeostasis of blood sugar, that's a real problem, and we need to do something to fix it. You don't need to know these. I just wanted to give you some examples. Okay, how do we maintain homeostasis? I'll tell you how. First of all, we have two body systems that are overseeing or regulating this process. You should know those. The endocrine and nervous systems. They are the ones that are constantly overseeing, hey, wait a minute, is core temperature where it needs to be? If not, let's fix it, right? You probably understand the nervous system because our brain is constantly sending nerve impulses to all the organs in the body. We get that. But you may forget about the endocrine system, which releases hormones that also regulate our organs. So know those two systems as the primary overseers. When we talk about an example, we tend to talk about three parts of a homeostatic loop: the receptor, the control center, and the effector. Make sure you know these. This slide is busy, and apparently on my iPad here, some of the wording has gone a little haywire. But don't worry, you got me. Okay, you got this, everyone. We think of balance as nice and level. We like balance. So if something is balanced, everything is hunky-dory and good. But let's be realistic. Sometimes it changes. What if we're talking about core temperature? This would demonstrate a nice balanced core temperature, 98.6 degrees Fahrenheit. But what if our core temperature abnormally goes up? It's really, really hot out. Well, there has to be some kind of receptor, and that's the first step. There has to be things in the body that constantly sense for changes. In other words, we have to have receptors in our gut to tell us what the temperature is. We have receptors in our skin to tell us what the temperature is of our skin. If we don't have receptors, we would never know that something's wrong. And these receptors are usually specialized cells lining our organs. And each type of specialized cell is able to sense a different thing. A thermoreceptor is able to sense changes in temperature. A baroreceptor is able to sense changes in pressure. Well, if we have an increase in core temperature that's abnormal, the receptors notice that, and then they're going to communicate to the control center, which is most often the brain. So the receptors send a nerve impulse to the brain saying, hey, wait a minute, our core temperature is getting too high. It's a problem. The control center or brain is going to process that information and think, oh my God, that is a problem. How are we going to fix it? And the control center will communicate to an effector. An effector is whatever it is out in the body that's going to make the change. It could be a sweat gland. It could be a muscle to contract or relax. So really, effectors can be anything out in the body. But most importantly, the effector is going to be whatever in the body happens to fix the problem. If our example is that our core temperature has gone up too much, the effector would be the sweat glands. And the sweat glands will release sweat to cool the body, therefore bringing the core temperature back down to normal. Make sure you know these 3 key parts. Good. Some extra information. The control center is usually the brain. The effector is usually a muscle or an organ, but it really depends on the situation. Now, when we talk about a feedback loop, a homeostatic feedback loop, there's really only 2 possibilities. When we have a change from normal, whatever it is in the body, when we have a change from normal, the body will respond by either doing negative feedback or positive feedback. The most common way that we react to a change from normal is negative feedback. In negative feedback, when there is a change from normal, the response is to reverse the change. Sometimes you'll see the term shut off. I like reverse. In a negative feedback loop, whenever there's a change from normal, the body responds by reversing that change. The example that we just gave, let me go back. The example that we just gave, this is negative feedback. If our initial change from normal was that something was too high, in negative feedback, we fix it by lowering it. We reverse it. If something's too high, we lower it. The opposite would be true. In an example where something becomes abnormally low, what if blood sugar drops abnormally low? Well, in negative feedback, if something is abnormally low, we reverse it. We make it higher. And this is usually what you want. If we have a change in normal, we usually want to reverse it so it goes back to normal. So we like negative feedback. A simple example outside the body is a thermostat in a room. Again, I apologize. These words on my iPad got a little messed up here. But a thermostat in a room, this is an example of a negative feedback homeostatic loop. So there's a sensor in the thermostat that senses the room temperature. And if the room temperature becomes abnormally high or low, it will communicate to the air conditioner or the heater to reverse it to bring the room temperature back to where it should be. Good. Okay. There's many examples in the body. This is an example of blood calcium regulation. You don't need to know this specifically. Just giving you an example. Negative feedback is the most common, and we like it because if something changes from normal, we want to reverse it so it gets back to normal. Here are some examples of ways in which we maintain balance in the body using homeostatic regulation, negative feedback. All right. On the other hand, in rare instances, we have a positive feedback loop. And this is just the opposite. As I said, when there's a change from normal, our body has 2 choices. We can do negative feedback, where we reverse that change and bring it back to balance. Or we can have positive feedback. In positive feedback, instead of reversing the change, we keep that change going. So it's the opposite. In positive feedback, if there's a change from normal, we keep that change going. Now, in most instances, you wouldn't want this. If we go back to our example of core temperature regulation, positive feedback would mean that when our core temperature rises abnormally, in positive feedback, the body would keep the temperature rising even more, right? Well, usually we don't want that. The only two examples in the body where we like positive feedback is uterine contractions during childbirth and in the process of blood clotting. You should know these two examples. These are the only examples in the body where we actually want positive feedback. In blood clotting. I think this schematic is a little confusing, so let me just put it into words for you. When you have damage to tissue, you have a cut, you have tissue damage, you break a bone, you tear a ligament, whatever. When you have tissue damage, there is a release of platelets from the blood to the area. You can look at that as a change from normal. Usually, we don't send a bunch of platelets to an area. So in this example of blood clotting, the change from normal is that there's been tissue damage and the body sends a bunch of platelets to that area. Well, in a positive feedback loop, that change from normal, where there's platelets released to the area, keeps going, which means that the presence of platelets in that area causes a release of chemicals that bring in more platelets. And then when you have more platelets, it causes a release of chemicals that bring in even more platelets. In this case, we like positive feedback because it allows our body to bring in so many platelets all at once very quickly. And that's how we can form a clot and plug the damaged area and begin the healing process. So this is a rare instance where we actually want positive feedback. The other example would be uterine contractions during childbirth. So in this example, the change from normal, in a woman's body during childbirth, the uterine walls contract. That's a change from normal. In positive feedback, when the uterine walls contract, guess what? There's a release of chemicals, hormones, that tell the uterine walls to contract even more, which causes a release of more hormones that tells the uterine wall to contract even more. In this positive feedback loop, the benefit is that the uterine walls contract so much that it pushes the baby out. So those are the only two examples. And again, I apologize for I haven't figured out how to stop my texts from showing up on the screen here. But I have nothing to hide. I'm not doing anything dirty. Okay, good job, folks. So the second part of this first chapter is all about terminology. And I bet many of you already know some of these things, so it may be a review, which is great. If these are new terms to you, make sure that you know them. We want it to become a part of your vernacular. So you need to know these terms so well that it just becomes your common language when talking about the body. Okay, when we're making any type of directional or reference term, we always refer to things from what's called the anatomical position. That just means facing forward, but the important thing is that the palms are facing forward in anatomical position. In other words, when we're talking about the front of the body, well, of course we mean the front, the chest, the abdomen, but because your forearms, you could have your palms facing forward or you could have your palms facing backward. So in anatomical position, the front would be the palm side of your forearms and hand. Here are some directional terms. And again, it's important to have a common language. So when you write in your notes, patient complained of pain superior to the elbow, that everybody knows what you mean when you say superior, and that means above or more towards the head. All right, superior means towards the head or up. You may also think of this as above. Inferior means anything towards the feet or below. So if I say patient complains of pain slightly superior to the elbow, I know that you mean superior is a little bit above the elbow. Patient has a laceration slightly inferior to the knee. Well, when you say the laceration is slightly inferior to the knee, I know you mean slightly below, more towards the feet. Then we have words for front, anterior or ventral, and words for back, posterior or dorsal. You need to know both of these terms. I think dorsal is pretty easy to remember. It's posterior because you think of a dorsal fin on a shark or a fish or whatever. Medial means towards the midline. Lateral means away from the midline. We think about the belly button and the sternum as your midline. Think about the ligaments of the knee. The medial collateral ligament is on the inside of the knee because it's closer to the midline. The lateral collateral ligament is on the outside of the knee because it is further away from the midline. Now, the proximal and distal can be a little tricky, so you may need to spend a little extra time on those. Almost always, when we use the terms proximal and distal, we're talking about the arms and legs. Probably the best example would be the arms. Proximal means closer to the attachment. In the case of the arms, the attachment point is the shoulder. So we could literally say closer to the shoulder. On the other hand, distal means farther away from the attachment, where the arm attaches to the body. In other words, the shoulder. So for example, I could say, when taking blood, the needle is inserted slightly distal to the crease of the elbow. And when I say slightly distal to the crease of the elbow, you know it means a little bit further away from the shoulder or below. But be careful because this does not always mean the same thing as above and below, like we talked about with superior and inferior. The best example of this, with your arm, you could have your arm raised up above you, like you're raising your hand in class. Even in that position, I could describe the point where the needle is inserted to take blood is inferior to the crease of the angle. When my hand's above my head, distal. See, look at me even making mistakes. Let's repaint the picture. As I'm sitting here, I'm actually doing it. Maybe you could do it too. My hand is above my head, like I'm raising my hand, like I have a question in class. I could still describe when blood is drawn, the needle is placed slightly distal to the crease of the elbow. Distal means further from the attachment. In this position, where my arm is raised above my head, I could also describe that position where the needle is inserted to take blood as superior to my crease of the elbow because it's above. But proximal and distal are preferred when talking about the arms, especially, because the terms mean the same thing no matter what position your arm is in, whether it's anatomical position or above your head or whatever. Have a look at those. They're a little tricky. Reach out to me if you have questions. All right, superficial and deep are pretty straightforward. I think of a burn as the best example, or a cut. You could have a superficial burn, which only affects superficial or top parts of the skin on the surface. Or you could have deep burns or a deep cut where it goes, deeper. All right. I don't know why these words are getting all jumbled. I apologize. Hopefully when you view the PowerPoints on your own, they're not jumbled. In this case, it doesn't matter. You don't need to know these regional terms. I think, quite frankly, it would be absolutely ridiculous for me to ask you to memorize all these terms. It would not be a very good use of your time. But I just wanted to point out that we have terms for regions. Some of these you already know. You know what nasal means. You know what the breast area. You know what the femoral area, the pubic area. So you know a lot of these. As we get through the semester, you might learn more of them. We also have regional terms on the back, like thoracic or lumbar or gluteal. There's some that you may not know yet, like the popliteal, which is behind the knee. So these exist, but you don't have to know them for now. Hope you're okay with that. Haha. Excuse me, allergies are coming back here. All right, moving on to other related things to terminology. It's possible for us to have these invisible planes. So it's like an imaginary plane cut through the body. And we have 3 of them. And I'd like you to know each of them: sagittal, frontal, and transverse. Let's go to the picture. Here it's called median or mid-sagittal. I just like to call it sagittal, makes it easier. The sagittal plane is an imaginary plane that divides our body into right and left halves. The sagittal plane is an imaginary plane that divides our body the whole way down into right and left halves. Nobody should miss the frontal plane, because the frontal plane is an imaginary plane that divides the body into front and back halves. The frontal plane is an imaginary plane that divides our body equally into 50% front, 50% back. And then lastly, we have the transverse plane, which is an imaginary plane that divides the body into top and bottom halves. You should know these. Now, why on earth do we care about these imaginary planes? Well, it's because it can be useful, I'm sorry to say. I've given you 2 examples of where they can be useful. I went too fast there. One example of when they can be useful is when viewing X-rays or CT scans, any kind of imaging. Not that you're going to be doing this a lot, but it's still a good exercise in helping us understand the human body. Here's a CT scan of the head. Well, obviously, see, now that you know, it's a sagittal view. We've made an imaginary cut that divided the head into right and left halves. Here we're looking at the right half. This is a sagittal view of the knee, an MRI, right? It's a sagittal view, meaning that this picture of the body is taken as if we've cut the body into right and left halves. Look at the one on the left. We do have some pleural effusion, not good, right? But this is a frontal view. It's a front view of the chest. On the right, unfortunately, we have some intracerebral bleeding. It's not good. But the idea is we have a transverse view. It's almost like we've cut the skull and the brain into a top and bottom half. I'm not going to ask you to look at an image and tell me what view it is on a quiz, but I just want to give you some practical examples. And another way that these planes can be useful is if you're in a laboratory and you're making a dissection. So, in some of the classes I teach at Hudson Valley, we do a sheep brain dissection. So if I say to my students, I'd like you to make a sagittal cut, you know what that means. That means you're going to make a cut that divides the sheep brain into a right and left half. So, they do kind of matter. All right. We're coming towards the end here. Bear with me. Another thing that we need to talk about is how our body has these separate cavities. Bear with me. So we have what's called a dorsal and a ventral cavity. Of course, dorsal means back or posterior. Ventral means front or anterior. Let's go to the picture. Here we see everything in red is considered the ventral cavity because it's on the front. Everything on the back is considered the dorsal cavity because it's on the back. I think one way to maybe better understand this, and it's a little bit morbid, but if we had a human body and if we literally took all the organs out. You know, in the lab, sometimes in my classes, we dissect a rat, and we can actually do this. We open up the rat, we observe the organs, and then we can take them out. So if we remove all the organs, the heart and the lungs and the intestines, if we remove everything, we're left with these cavities. You know, the alternative would be that there's no cavities at all that are separate. The alternative might be that it's just one big body and we just throw the organs in together. But obviously that wouldn't be good. So it's by design that we have these cavities. It keeps the organs separate. So we want to keep the organs that work together in their own little cavity. Don't we want the heart and lungs in their own little cavity? Don't we want the brain in its own little cavity and the spinal cord in its own little cavity separate from the heart and lungs? Of course we do. Not only does it keep organs that work together closer, it also prevents the organs from moving around a whole lot. You wouldn't want the heart. Can you imagine? What if we have the heart? Can you imagine the heart just suddenly, oh, I'm going to go down here? That would be terrible. Well, it can't because we have a separation here that keeps the heart and lungs up together where there should be. So it keeps organs together, but it also means the fact that we have these separate cavities also means that if there's a problem in one cavity, it can be better contained. What if you have a GI bleed? What if your appendix ruptures? Well, in that case, we're able to contain that damage. So your appendix rupturing wouldn't have fluid going into your spinal cord. That would be bad. So these cavities, they're there on purpose. All right, so make sure you know our two basic cavities, front and back, ventral and dorsal. And then we have some subdivisions. In the dorsal cavity, we have a cranial subdivision. Guess what? Houses the brain. And we have a vertebral subdivision. Guess what? Houses the spinal cord. On the ventral side or front side, we have the thoracic cavity, houses the lungs and heart, and the abdominopelvic cavity, which has your GI organs and reproductive organs. Let me go back to this one. Here are our subdivisions. I love this little pen. It's a teacher's dream. So our subdivisions, so the yellow is dorsal. So we have our cranial subdivision, houses the brain, and we have our vertebral subdivision, which houses the spinal cord. On the ventral or anterior or front side, we have the thoracic subdivision that houses the heart and lungs. And then we have the abdominopelvic subdivision, which houses our abdominal and pelvic organs. What I do want to point out, and you should know this, what it is that's separating the thoracic and abdominal cavities is your muscle for breathing, known as the diaphragm. That's really important. If you were able to do the rat dissection, I mean, you could probably look on YouTube, right? In lab, we do the rat dissection because their organ arrangement is very close to ours, so it makes sense. When we look at the rat, guess what? We can see the heart and lungs in the thoracic cavity. We can clearly see the diaphragm separating the thoracic cavity from the abdominopelvic cavity. Kind of cool. There are other subdivisions, the mediastinum, the pleural cavities. You do not need to know the other subdivisions. Okay, we are coming towards the end, folks. Now, when we look at the abdomen, let's face it, there's a lot going on. We have so many organs, so much going on, so it's beneficial for us to be able to further subdivide just the abdomen or the abdominopelvic cavity of the ventral cavity. You could use a 9-region system. That might be used more by surgeons. We're going to use the good old-fashioned 4-quadrant system. I'm sure a lot of you have heard of this, hopefully. Either way, you're going to know it now. So we have a very simple way to divide the abdomen into 4 quadrants. The belly button, the fancy word for belly button is umbilicus. The belly button serves as the dividing line. It divides both the top and bottom, or upper and lower, and it also divides the right from the left. Make sure you review what main organs are in each abdominal quadrant. Liver and gallbladder, upper right. Stomach and spleen, upper left. Intestines are in both lower sides, right and left. The appendix, particularly, is in the lower right. Make sure that we are considering right and left as what it would be on that person. So this person, their right is on this side. Their left is on this side. So that's how we would call it. I do want to make a point of the pancreas. The pancreas, let me change colors here. Good. The pancreas is behind the stomach. So in this picture, it's hidden. If I was going to draw the pancreas, I would draw it kind of like this. We've got a head, and then we've got a tail. I'm not a good drawer, folks. You'll get to know that over the semester. So the pancreas, you'll see it listed most often in the upper left because more of it is in the upper left. Its head or biggest part is in the upper left, and its tail or smaller part goes to the upper right. But I just want to point out that part of the pancreas is absolutely on the upper right side. It's just that more of it is in the upper left. The belly button is what's dividing it. Fancy word is umbilicus. And you can understand why this is important. If someone has pain, if we know what organs are in each quadrant, we could know what organs are where the problem's at. Of course. A great example would be the lower right quadrant. So if we were to divide this abdomen into upper and lower, of course the appendix is in the lower right quadrant. There is a way to approximate exactly where the appendix would be. You don't need to know this, just giving you an example. It's called McBurney's point. If you look at your belly button and then the front of your pelvis called the ASIS, sometimes people will say it's halfway between those two landmarks. Some people will say it's 2/3, a little bit more towards the front of your pelvis. But either way, that's a really good approximation of where the appendix is. You don't need to know this. It's just extra. Okay, the last thing I want to point out, and this is our last slide, welcome, is some prefixes and suffixes. You do not need to know these. I just want to get your brain going, because as we go through the semester and as we go through organ systems, you're probably going to come across words that you are not familiar with. Yeah, well, you can sometimes break the word down, and you know more than you think you know. You probably already know osteo is a prefix for bone, osteoporosis, osteocyte. Hemo is blood. Hemology, the study of blood. A blood doctor, you'll see hemo, right? Histo means tissue. Histogram is a injecting dye to look at tissue. Hypo means less than. If we look at blood pressure, right, you could have low blood pressure or hypotension. Chondro means cartilage. Rhino means nose. You do not need to know these. I'm just encouraging you, when you come across a word that you don't recognize, try and break it down. Look at the suffixes. Ology means study of. Histology, study of tissues. Everyone probably knows ectomy, which means removal, and appendectomy, right? Removal of the appendix. A clast, we might have, for example, an osteoclast. Well, clast tells us it's a cell that breaks down. An osteoclast is a cell that breaks down bone. Osis commonly refers to some kind of condition. Osteoporosis, endometriosis. usually if you get a diagnosis of an OSIS, it's not a good thing. All right. Good job, everyone. Thanks for watching. If you have any questions, let me know, and I'll see you for the next chapter.